Welcome back to the Pediatric Breathing Project podcast. I'm your host, Dr. Piya Gandhi, and we have an incredible guest today with us. This is Leah Whitley. She's an international board certified lactation consultant that I've had the pleasure to work with for many years now.
Yeah.
It's been about 7 or 8 years. We've worked together, we have lectured together, and we've just spent a lot of time getting to know each other personally and professionally. She is a wealth of knowledge in the lactation world and has personally taught me so much. I wish I knew her when I had my babies. So welcome and thanks for being here today.
Thank you for having me. I'm excited to be here.
Yeah, so I would love to start just by hearing about like how you entered into lactation and then really like took it to the next level with your training and now really focusing on helping babies with tongue ties and just your story.
Yeah. I got interested after I had my oldest daughter. So I have 3 daughters. They're all teenagers now, but it really wasn't on my radar before I had her. Have you heard this story?
I don't know.
Okay.
I don't think
I'll
so.
tell you.
Okay.
So I had my oldest daughter. I was so terrified about the birth process. I did not do a lot of research about breastfeeding. My husband would, think of things and be like, yeah, I was thinking of childcare. And I'd be like, whoa. Presumably, if I survive the birth, then we can talk about that, right? So when I had her, I knew very little about breastfeeding. My midwife had told me you should really try to breastfeed, so I did. She was born. I tried to breastfeed her. We got discharged from the hospital and it was night 3. My nipples and breast were on fire. I didn't know if I was doing it right. I didn't know if she was getting enough. I knew absolutely nothing. It was 2:30 a.m. I woke up. I didn't even wake up my husband, Prentice. I woke up in my pajamas, drove to Walmart and bought a can of formula.
Oh
I don't even shop at Walmart. I shop at Target, but I knew that Walmart would be open. So I came home, and by the time I came home, Prentice, my husband, he had woken up, and he was just like, are you okay? Where have you been? And I told him, I said, I can't do this anymore. My nipples are on fire. This isn't working. I don't know if this is the way it's supposed to be. It's just a lot. I think I'm just going to formula feed. And then he looked at me and he said, no. And then I thought to myself, this is terrible because now my daughter is going to be an orphan because I am going to murder her father. They're going to lock me up in prison. I'm going to be gone for the rest of my life. She will have no parents. This is really bad. But then he looked at me and he said, Leah, I saw you pregnant for 9 months. I saw you have the baby. I know you can breastfeed. And he was like, can you make it to the next day? And he helped me find someone to come and help me with lactation the next day. And the rest is history. After that, I was hooked. But that was my introduction to breastfeeding. Yes.
That
was my saving grace.
Like chills. I did not hear that story.
Absolutely. That was my saving grace. It was just latching, but it completely transformed my breastfeeding experience. After that, everything was really, really good. That's what got me interested. So that's when I decided to make a career change. And by the time my second daughter was born, I was pretty much just waiting to sit for the exam.
Wow.
Almost everything was in place. And yeah, that's how I got started.
That's crazy.
Yeah.
You touched on this a little bit in your story, but it's not just about the baby being able to breastfeed, but the impact that it had on you.
Oh, absolutely.
As the mother, which is life-changing.
Yeah.
So when you see your clients, you're not just helping that baby, you're really helping the whole
family unit. You're looking at the entire family unit. So, what do we need to do to get this baby feeding well? What do we need to do to get this baby just functioning most optimally? What is something realistic that the mom is going to be happy with? What is a sustainable plan? How can the dad support her? How can we bring him in so she's not feeling like she needs to do everything solo and he's just kind of looking behind the window? So yeah.
Well, and that was a huge part of your success was Prentice's support.
Absolutely.
So it really makes a big difference. And you mentioned you were, by the time your second one was born, you were going to sit for your exam. So tell us a little bit about what the training process is to become the level of lactation you are, which is board certified.
For sure.
Yeah.
Because there are a lot of different levels to lactation care, and everyone doesn't realize that. So we have breastfeeding peer counselors. They are people that get some extra training in breastfeeding. There are other lactation kind of specialists that are out there. But what I am is an international board certified lactation consultant, which is kind of the gold standard. So the training is a little bit more rigorous. So there are certain courses that you have to take, lactation specific classes that you have to take, and then you have to get so many clinical hours, hundreds of clinical hours, being supervised by another lactation consultant that is board certified, and then you sit for the exam. Mm-hmm. And when you sit for the exam and pass the exam, that's when you get your title of an IBCLC. So all lactation professionals are really great, but if it's something where you're having a complicated feeding issue or you really need a certain level of expertise, it is important to be able to differentiate the difference between the others and make sure that you're getting someone in that's prepared to help you with what you need help with.
And this would be someone that on their title has the letters IBCLC. So that's really what you're looking for.
That's what you're looking for. It's a mouthful, but that's what you're looking for.
Really.
IBCLC is like a certified lactation counselor. And like I said, there are other kinds of breastfeeding professionals out there that can be helpful. But when we're talking about things like Airway, when we're talking about things like oral restrictions, those types of things, it really would behoove parents to have an IBCLC because they'll have a little bit more of a foundation to be able to help them with those things.
And I think, you know, as a mother myself and so many others, and you as well, we had this goal to want to breastfeed. And I know personally, I didn't really know why it was so important. I knew it was like, I want to breastfeed. It's like what I'm supposed to do. And I knew that it was good for the bonding and good for immunity. But now we know that there is just so much more benefit, and it plays such a huge role in airway development, the way our tongue is moving. So maybe go through kind of when a tongue is moving properly, what does that movement look like? What does that feeding look like? And, you know, the positive impacts it will already have, because that's our first touch point for creating a healthy airway.
Absolutely.
Is infant feeding.
Absolutely. So like I work with parents all the time. I just came from a consultation and I was talking to the mom, and the baby isn't really holding good tongue positioning. The tongue has kind of low tone. It's a little bit floppy. And one of the things that parents will often say is, well, can't we just bottle feed? But see, that's a go around. It's kind of a Band-Aid. It's not addressing the real issue. You need for that tongue to live on the roof of the mouth, apply pressure. You need for the tongue to be able to cup and hold good positioning to transfer milk from the breast adequately. So breastfeeding, people think, oh, it's just breastfeeding, but there's a lot of specific motions that the tongue has to do in the right order for that to work effectively. So that's what we're looking for. Going in, doing an oral assessment, checking, making sure, you know, is the baby cupping the tongue well? Are they extending well, elevating? Are we getting that peristalsis? How does that translate into a feed on the breast? What does the breastfeeding look like? And really kind of scrutinizing it to make sure that you're getting all of those little markers showing that the feed is being successful.
And if things are not working well, what are some of the more common symptoms that a family will experience?
Feeding patterns, I would say number one. I'm so glad that you asked that because I feel like there's so much emphasis on diaper. Do you know how many pictures of dirty diapers I have in my phone? So many poop diaper pics, and it's great, like no problems with it. But there's a lot of emphasis on you're going to know that your baby is feeding well if they have the right amount of wet and dirty diapers. And so often you can have a baby that's really struggling with feeds that's still giving you good diaper output, so it's not foolproof. What I found in my experience is that when you have a baby that's kind of struggling with feeds, a lot of what you'll notice is that their feeding patterns are just a little bit atypical. We tend to not feed often enough. We feed too often. Our feeds are very, very short, or our feeds are trending too long. And so a lot of times I'll have parents, they know kind of what normal feeding patterns look like, but they don't recognize the importance of getting help when the baby kind of falls off of that.
Okay. And what about like from a latching standpoint, besides not being able to latch, what I hear a lot is we saw somebody, lactation professional, and everything looked good. Because
Yes.
it looks good from the outside.
Yes.
So let's say it looks good.
Yeah.
What are the other things that a parent could see that would indicate, besides the frequent feeding or longer feedings, that would indicate, oh, something is not the way it's supposed to be?
Pain
Okay.
when they're breastfeeding, for sure. So a lot of times I'll have moms and they're in a lot of pain breastfeeding, but they'll kind of push that to the side and say, other than me being uncomfortable, everything is working well because they told me that the latch looks good. So it's important to remember there's two things to look at with latching. We're looking at what it looks like from the outside, but one of the wonderful things of having a professional come in that can do an oral assessment is you also need to know what the mechanics inside of the mouth are doing. And things can look good from the outside, but not necessarily be good on the inside. So if you have a baby that's doing funny mechanics with their tongue, maybe humping the back of their tongue, they struggle with extension or they struggle with elevation, you might see that they're not keeping a good suck to swallow ratio, that the feeding is very ineffective. And that's when we might start to see that maybe the weight gain isn't so great or the baby isn't getting enough to eat. You might have moms that are having nipple pain or noticing that their nipples look creased or blanched at the end of feeds as a result of the baby putting too much pressure on the nipple tip with the tongue mechanics as they're sucking. You can see things like reoccurring plugged ducts or mastitis because the flow of the milk, we're having areas where we're getting backed up. It's not being drained adequately as often as it should be, and so that's causing the mom's breast issues.
And then along those lines, if that continues, that drainage doesn't happen, then at some point the production will decrease.
Absolutely, absolutely. So I remember talking to you about this way back in the day, but just a lot of parents are not 100% clear on how milk supply works. When you're taking breastfeeding classes or you're reading breastfeeding literature, a lot of people will focus on supply and demand. The more the baby feeds, the more milk your body is going to make. The less the baby feeds, the less it will make. And they don't understand that that is true, but not quite like that in the beginning. In the beginning, it's your hormones, that elevated prolactin, that's going to drive your milk supply. So you can have a baby that's not feeding very well, but if the body is still just hormonally making that milk, they can ride that milk let down and get by with getting enough, even though they don't have great sucking skills. But at some point, your body is going to change how it makes milk. And when we see that shift occur, where we really do get into supply and demand, then because the breasts have not been stimulated adequately, we will get a dip in milk supply. And that's when we start seeing the baby is not getting enough to eat and everything can kind of start to unravel. And at that point, your body is wanting to establish the supply. It wants to decide how much to make. So early intervention is really important.
These are the families that come in babies 3 to 4 months old and they're like, everything was going great. And now everything, like the wheels are falling off the bus.
Exactly. Like my milk was wonderful, breastfeeding was great, everything was fine. But then out of nowhere, I feel like my milk is just gone. My supply is down. The baby is fussy when feeding. But when you go in and you do a thorough history, you'll usually find that everything wasn't great. But if you don't know all of those details and you're just, counting wet and dirty diapers, it's easy to think that things might be a little bit more solid than what they actually are.
Touching on like bottle feeding, not everyone, whether for, work purposes or feasibility purposes, cannot breastfeed.
Right.
If a family does need a bottle feed, I think it's also important to know that there are different types of bottles that will have the tongue do different things. But also there's a technique to bottle feeding. So
there is a technique to bottle feeding.
What do you, when a family needs to combo feed or bottle feed, what are the things that you kind of recommend that they do to mimic good tongue movement or, and help promote that airway development?
With the bottles, it's not really so much a one size fits all. And this is something that I discuss with parents in prenatal consultations all the time. They'll say, well, what bottle should I get? And I can tell them, well, these bottles have a higher likelihood that your baby is going to look good on them. But a lot of that, we need to see what the baby actually does with that bottle. And a bottle that works well for one baby and family might not work well for another baby and family. So really with bottle feeding, what we're doing is we're trying to get the baby to mimic as many of the same sucking skills as similarly as possible with breastfeeding. It will definitely not be the same.
Sure.
But we don't want to ask them to pivot too much and do things that are totally different. We want to pay attention to the flow rate because that will affect, you know, their sucking skills too. If that milk is just coming out and they're guzzling, they're going to get very sloppy just to try to keep up with the pace.
Yeah.
So those are kinds of the things that we're looking at. And I'm really glad that you brought that up because almost everyone bottle feeds here.
Yeah.
You know, even moms that have babies that are exclusively breast milk fed, most women work.
Yeah.
Or they have moments where they're going to be away from the baby.
Yes,
and usually the tool that we're going to use is a bottle to get that milk in them.
What about pacifier use? What are your thoughts on pacifier use? Are there pacifiers that you recommend people using over others? Where do you stand on that?
Where do I stand? You know, I'm not big on pacifiers.
Okay.
But
neither am I.
At the same time, there's almost always an exception to the rule. So if I have a baby that's really struggling with sucking skills, it could be that it might be appropriate to have a pacifier to use with some oral exercises.
Yeah, sure.
You know, limitedly speaking. What we try to avoid is babies that are just sucking on pacifiers for extended periods of time and just self-soothing that way.
What about shape of the pacifier?
Yeah.
Do you have comments about the shape?
We like pacifiers where the baby has to at least cup the tongue, extend the tongue, hold with the tongue.
Do you have certain brands that you like?
You know, if we're talking about cupping and extension, you know, things that are a little bit more round, like a Philips Avent, maybe a Dr. Brown's, and Ninny Co. That's one where the silicone is very, very thin. The baby is going to have to activate the back of the tongue to be able to hold on to that.
I like that
it's going to require a pretty good skill set. I try to avoid pacifiers that typically are very bulbous, where the baby doesn't do anything; it just sticks in there.
I see that one very commonly, and
they'll say, "Oh, but this is what my baby likes."
Yeah, it's because it doesn't take a lot of skill.
It's because it doesn't take a lot of skill, and you pop it in there, it's not going to come out most of the time. You know?
Yeah, you know, when we do tongue tie releases on infants, we tell them they cannot use a pacifier post release, and that if they need to, then it's one of those ones that you just had mentioned.
Right.
But very limited.
Right.
Speaking of tongue tie releases, you obviously work on our team when we do these for infants, but as a IBCLC, when you're doing your oral assessment, I know you're screening for these things. And what is the process if you identify that a baby may have an oral restriction? What does that conversation look like? What does the sort of prepping look like, and that sort of that thing?
If it's something where we know the baby has oral restrictions, I will usually just start out by making sure that we have a plan set up to protect the mom's milk supply.
Okay.
So if the baby is not able to drain the breast adequately, do we need to use our hands? Do we need to use a pump to make sure that our milk supply doesn't diminish? And then, of course, ensuring that the baby is getting enough milk in to gain weight well, however we need to do that. And then also just prepping them. Like, let's start getting inside of the baby's mouth. Let's gently start asking them to do a lot of these different movements that their tongue is going to need to do post-release so that we're getting that started. If I know they're going to go into a release, I definitely want to show them the post-release exercises in advance if we can. Like, this is how we lift the tongue. This is how we lift the lip to make sure that they heal properly post-release. Not that you have to start doing that a lot in the beginning, but if parents can be a little bit more familiar, absolutely.
Yeah.
And you know, those newborns, they're squishy. I know. A lot of people are really nervous with them.
Yeah.
So practicing before is super important.
And what are you looking for in a baby?
And body work.
And body work, yes, of course. I was going to say, what are you looking for in a baby for them to be ready for the procedure? Because, you know, on our team, we check in with you and the body worker and say, is this baby ready from your standpoint, what does readiness look like?
Readiness looks like, okay, we have a good plan kind of in place to preserve things. We have parents that are able and willing to get into the baby's mouth and work with the baby, so we know they can be consistent with the post-release care. We have a baby that's making good effort to do all of the different motions and mechanics that you want them to do. If I'm working with the baby, I always talk to my babies, but if I'm working with the baby and I'm like going in, and a lot of what we're working with are reflexes, and I'm asking them to do something and the baby is just sitting there,
not attempting,
and they're not attempting to do anything.
Yeah.
It's like, oh, maybe we need to like work on this a little bit more because
they're not going to magically do it after.
Exactly.
If anything, you can make it worse.
Exactly.
Yeah.
Exactly. So making sure that the baby is in a good place that way, and then just making sure that they have a good plan. This is what it looks like when you go in for the release. Mm-hmm. This is what you can expect the first 2 to 3 days afterwards. If this happens, don't be nervous. If this happens, call me. Just kind of walking them through it.
Absolutely.
Everyone feels more comfortable if they have an idea of what to expect.
Absolutely, yeah. And when you're working with providers, what are you looking for them to do? Like, when you're referring to providers, if there are any dental providers that do releases on infants, from your standpoint, what would you like to see them do in their practices?
Will definitely be very thorough in their explanation and evaluation. This is what I think the baby needs. This is why we need it. This is what I'm noticing. So, sometimes I'll have parents that go into providers and they'll say, yeah, they said the baby doesn't have a tie. And then I'm like, well, what are the details?
Yeah.
And they'll say, oh, he looked in there and he said there's no tie. And it's like, well, that's not really a very thorough assessment. Looking for providers that are good at working with other providers. So if it's something where they're noticing something that might be feeding related that I need to know, they can communicate that back with me and vice versa. If I'm noticing something and how the wound is healing, if it's a little bit off, I can have open communication with them as well. Looking for providers that are going to help the families feel comfortable. Mm-hmm. That's really big.
Yeah.
That's really big. I've walked into homes where, I'm talking with the mom and the dad, and it's like, okay, well, how do you... And, the dad might be like, well, he's a jerk, And it's like, well, maybe that's not the
provider for you.
Because you're going to have to keep going back and seeing this person.
Yeah.
So that type of thing, all of those little details make a big difference when you're in a situation like that where it's going to put stressors on the family.
Sure. I mean, it's a stressful situation.
It's a stressful situation.
Yeah. Do you, in your mind, is there an ideal time to treat a baby?
Oh, the right
age?
Time for that baby.
Okay, so you're saying individual for the baby or just generally?
Excuse me. Individual for the baby. Now, I tend to work with younger babies.
Yeah.
I work with young babies, but you and I both know toddlers can be savages. Okay. So if I start having a parent and their kid is getting into kind of that older realm, I will definitely let them know, okay, basically, depending on how compliant the child is, how well they sit, there might be a little bit of variability to this. Maybe it's a good time for you to go into the release, but it could be that you see the provider and maybe you might need to pause on it a little bit. But my main thing is going to be that baby is showing readiness. Yeah. They've been cleared from body work. They're showing all the things that I want to see to make me feel confident that they can continue to excel once they've had the release and that the parents are fully prepared to take it on. It's not good to jump the gun either.
I agree.
It's not good. And a lot of parents, when they know it needs to be done,
they want to go get it done.
They just want to get it done right then and there.
And you kind of have to talk them off the ledge.
Exactly.
Yeah. And
exactly.
But, I do think that is also part of just the way we look at medicine in general, which is very procedural. Really educating people on like a collaborative team approach where the approach is really procedure therapy,
absolutely,
not just procedure,
absolutely,
and done. And we're still working on that, and some people will come and see either of us and say, oh, I don't really want to do like a few lactation sessions and body work. I just want to go do the procedure. And, there are still providers out there that will subscribe to that approach, which is fine, the better fit for those families. But our approach is really full body function, and you're not going to get that by just doing an oral procedure.
It's true. Yeah. And I do feel like a lot of times when we kind of skip over all of the prep work For me as a provider with feeds, it can make it a lot more complicated on the back end.
Mm-hmm.
You know, where it's like, okay, this isn't as simple as it probably would have been if we could have ironed out some of these kinks in advance. And then sometimes I also get situations that just the outcomes, it's harder to get the mom's goals when there's such a delay. So, you know, sometimes I'll have moms and they'll say, well, I got the release, I wanted to breastfeed, I didn't think I needed to see lactation afterwards, but then things start to fall apart. And by the time they're reaching out to for lactation support, we're a little bit more limited with what we can do because we're playing catch up. And there's so many things that are just going to take a little bit longer to correct or be harder to address than they would have been before.
Yeah. Speaking of collaboration, are there instances where, as a lactation provider, you would rope in like a speech language pathologist to supplement what you're doing?
Absolutely. And I will say this too, I work with a lot of moms, and you know, if I see a toddler, they're giving me history of other kids that are a little bit older and it seems like they would benefit from that, I will very quickly refer and be like, hey, you should see this person, or you know, maybe they should see an SOP. But if I'm working with a baby where it's kind of getting beyond just the scope of feeding, we're having actual issues with the swallow or things beyond that, that's when I'm going to go with an SOP. You know, you see that it's not quite right, and I'm going to refer them to someone that specializes in that.
Yeah. Awesome. And then, like, if you could highlight a couple of things for new parents or even parents of subsequent children, because I always get this, that parents think like, oh, it's not my first child, so I kind of know everything. I don't need the lactation, or I don't need, you know, but every child is different. Clear indicators like, yes, it would be great if everyone saw lactation, but we know in the hospital that's very limited, that you should definitely, you're seeing these things, you should definitely reach out to a lactation provider.
Oh, anything that's making it difficult or anything that just falls beyond the realm of normal. So if you know, okay, this is about how often a newborn should feed, this is about how long they should feed, your baby's not doing that, reach out for help. If you are in a lot of pain, reach out for help. If there is anything that is making you question if you can do this another day, you should reach out for help, right? It shouldn't be that difficult. And I feel like a lot of moms take a lot on.
Oh, yes.
Do you know what I mean?
Yes.
And they'll just keep going.
Yes. And I was going to talk about like some myths, right? And I think one of them is that breastfeeding is supposed to be uncomfortable or painful. That's not true.
No.
Right.
No. It should not be. Now, of course, when you first start breastfeeding, your body is not completely acclimated to it. Of course, there can be some growing pains. You can have a moment where you start to latch and you doze, or the baby dozes and the latch ends up not being perfect, and maybe there's some soreness. But nothing crazy. I don't get it so much, but when I first started doing this way back in the day, there were a lot of wives' tales that I would have to dispel. Moms saying, well, you know, my grandma told me that I need to take a rough cloth and rub my nipples. And I'm like, God, no. No. And she's like, oh, it's my grandma. But she's like 80.
Yeah.
And like, I don't know what they were doing back then, but
what are, speaking of things that grandmothers and mothers tell us, that what are things that can actually help increase a milk supply?
Things that can help increase a milk supply, honestly, it's the basics that usually work. Breastfeeding on demand, meaning I am not imposing a feeding routine for my newborn. When they are hungry, I am feeding them. Babies are people. They eat best when they want to eat. You can offer them food, but if they're not interested, they won't do their best work. So feeding on demand whenever the baby is showing you cues. That's another reason we don't like pacifiers, right? Because we miss a lot of those cues.
Because we give them the passy instead.
We give them the pacifier.
Okay.
And then, but that's it. Now, if for some reason the baby is
what
not
about like
able
supplements
to feed
or things like that? Are there things out there that
you can, but we don't want to do that as like the first go-to.
Okay.
Those are usually added things that you put in when you're already addressing the underlying issue of this is why the supply is a little bit low, and these are the things that we're going to do, and we can add some of those things.
So again, looking at root cause, not
looking at
Band-Aids.
root cause.
Yeah.
You know a fenugreek.
Yeah.
Do you know it makes you smell like maple syrup if you eat a lot for a lot of parents?
Yeah.
I used to not mention that, but I had a mom once, and I was like, oh yeah, you're doing fenugreek, maple syrup. And she was like, oh my God, I thought I was going crazy. It's like waffles all the time. And I was like, oh, so now you can eat fenugreek until you smell like a Waffle House. But if you are missing a feed, it is not going to do the trick. It's not going to substitute that. Like, we have to make sure that the feeds are solid, that the breasts have the proper level of stimulation, that they're being drained adequately.
I say this because with my older one, I couldn't breastfeed and had a horrible milk supply. And the advice that I got was just it was insane. Fenugreek, yes, from my mom and grandma. My lactation provider told me that I had just moved to Texas, and I'm a New Yorker, so yes, we eat fajitas, but not like you eat fajitas here. She told me that I was not eating enough fajitas. Like, I just need to eat. Basically, I think she was trying to say I need to eat more fat, but she literally said fajitas. And I was like,
I've heard this
this
story.
Is just insane.
Because I like having a visceral reaction to it.
So this is why I was asking you, like, I'm sure there are mothers hearing all the things, and when you're desperate, you're gonna try
all
anything and drink anything and put anything on you that is gonna maybe work.
I've had moms that just start guzzling water and guzzling, all of the electrolytes because they've heard
mother's
that.
milk tea,
exactly,
and the cookies and the
exactly all the cookies, the lactation cookies. But at the end of the day, if the reason your supply is low is not because you're dehydrated, you can drink all of that. It's not going to help, right? So we have to figure out what's the problem and not try to mask it with this other stuff. I'm sorry she told you to eat.
Oh my gosh.
Like that.
I mean,
I hope it hasn't affected your relationship with fajitas.
I love fajitas. No, I love fajitas. But I mean, this is 13 years later now, so I've had some time to recover.
Because that's a lot. That's frustrating.
It is, and it's still 13 years later. There are still so many parents that are experiencing this.
That. Now, and it's possible that we could have a food sensitivity to something that we're eating, or maybe a mom is not consuming enough. But when I'm working with women that are trying to increase their milk supply, that is at the very top of why they think they're having milk supply issues. But in the totem pole of issues that could impact supply, usually that's at the very bottom. Yeah. It's possible. It's just not as probable.
Yeah. I mean, this is why it's so important to have a professional come in and really see.
Absolutely.
And I think a big, from a parent perspective, if you have a lactation provider that's assessing you, if they're not doing an oral assessment, then they're not doing a complete assessment.
Absolutely.
Similar, like you were saying, with the dental providers that do the releases, it has to be complete.
Absolutely.
So if someone is just glancing at you from the outside and they have not actually put their finger in the baby's mouth, there's a potential to miss something.
And I also think it's important to go to someone that has training specifically in that area.
Yes. So talk to me a little bit about that. Do you get that training?
Well, I will say this. When it comes to being an IBCLC, it really should be better. So the formal training when it comes to oral assessments and ties is very limited. You're usually going to get the best results if you have someone that has a lot of additional training specifically in that area so that you can make sure that you're up to snuff. Yeah. But a lot of parents, they're really relying on the hospital staff to tell them that the baby is tied, or they'll ask at the pediatrician appointment. And it seems like that would make perfect sense. But since that kind of falls outside of their sphere of formal education.
Well, even in dentistry and in medicine, it's like this black hole that has just been kind of, no one has talked about it enough.
Absolutely.
And what I see is the ones that are caught in the hospital or by pediatrician are the ones that are the real obvious anterior ones. And then there's not the team approach before and after the treatment. So some of those releases work, many of them don't.
It's true.
And then in the parent's head, they've kind of also checked the box of I've taken care of the tongue tie, So that can't be the problem.
Exactly.
When really many times it is still the problem.
Exactly.
So that's a very frustrating experience.
And very common.
Yeah, very common.
Very common.
Very common. And so, our goal is to, it's great if they identified in the hospital. I would pause before I treated in the hospital and really work on a team approach first.
I just don't think families should be overly reliant on that. So it's great if they catch it in the hospital, but I would say, just because no one necessarily mentioned that doesn't mean that it's not
there.
A problem.
Yeah.
So if we have a lot of symptoms that this could be a problem, it's going to be good to go to someone where that's really their wheelhouse and have them do a very thorough assessment.
There is a hospital here in Houston, this was years ago, that I kind of offered to go in and screen babies.
Oh.
And I think if that practice could actually come to fruition.
What happened?
What happens in every hospital, red tape. And,
of course.
This is still considered somewhat controversial. We are closest to one of the biggest medical centers in the world.
Right.
And the medical team is not up to date on this.
Right.
That's just the reality.
Right.
And so they are very resistant. And it's unfortunate because the people that are suffering are the families and the babies and the airways that are not being developed properly because these babies are not feeding well.
Right.
And so I would love, if there's any hospital listening that is interested, I would love to implement some sort of screening process by a trained professional. It doesn't have to be me, in the hospitals for the babies.
Yeah.
I think it will close a huge gap.
Absolutely.
But we're just not there yet.
Not there yet.
Yeah, so parents have to be their own advocates.
Yeah.
And that is what we're here for.
Absolutely.
So if people are in Houston and want to reach out to Leah, SOS Lactation.
SOS Lactation
is her company. But if someone is not in Houston, how do they find an IBCLC? Are there resources out there?
Yeah. I would definitely do a Google search and look up lactation consultants in your area. Just make sure that they're IBCLCs if you're needing something more in depth like that. There is a board of lactation consultants. The acronym, it's going to escape me.
We'll put it in the show notes.
We'll put it in the show notes where people can look up, and it won't have all the IBCLCs, and many of them are affiliated. So usually you can do a regional search in your area and see exactly who's there.
Awesome.
Yeah.
Well, thank you so much for being on here. This was a great conversation. And as always, I always learn something every time I talk to you. Thank you for being a great asset to our community.
Thank you.
And I hope that we continue to work together.